Welcome to another episode of Your Health, Your Life. Today I want to talk about what we call effusions, lung effusions. Now when we talk about lung effusions, we simply mean that you have an accumulation of fluid in your lungs. Well, for us to understand that, we're going to just briefly describe what the lungs actually look like. So when we talk about the lungs are actually tissue or cells that are found in our chest, alright? So the lungs are comprised of tissue that is responsible for exchanging oxygen and carbon dioxide. I think most of us know that. But what some of you may not know is that the lungs actually sit in a bag, alright? And this bag is something that we refer to as the pleura. So the lungs are housed in a bag, which is in the lungs. Now that bag has a fluid which helps the lungs to expand and relax very well. Yeah. But in some cases, you can have excess fluid accumulation in the bag that surrounds the lung. And when that happens, that's what we call an effusion or a pleural effusion, going with the name pleura, fluid, pleural effusion. So what we want to talk about today is what are called parapneumonic effusions, which simply means that effusions or fluid accumulation that occurs after somebody has a pneumonia. Now, most of you may be familiar that pneumonia is just an infection or inflammation of the lung that can happen due to various reasons, mostly because of bacterial or viral infection. But you can also have fluid accumulating within the lung because of infection. Now, effusions can be classified as simple, complicated, or empyema. When we talk about simple effusions, basically these ones will be managed differently from the ones that we call complicated and then the ones that we call empyema. When we say empyema, we just mean that effusion, that fluid accumulation, now has pus. Alright, so instead of water, there's pus, and most of you may be familiar with what pus is. So your doctor is going to manage that effusion differently if it's a simple effusion, if it's a complicated effusion, or if it's an effusion that has pus. So when you go to the hospital, your doctor will do various tests on that fluid. So they get a needle and they'll go inside in the pleura, in the bag, to get part of that fluid. They'll take it to the lab to look for specific things. And those things that they're looking for are going to help them determine what type of effusion you have, whether it's simple, complicated, or whether it's pus. And that is what is going to determine how you're going to be treated. So usually treatment is going to involve use of antibiotics. For certain patients that have complicated effusions and empyema, it will also involve putting a drain to drain the fluid. Usually recovery is fine in a couple of days to weeks. Patients usually go back to their normal lives and the wound eventually heals. That is if they put a drain. So we were talking about parapneumonic effusions, which are effusions that occur in the bag that houses the lungs because of infection of the lung, which we call pneumonia. It can be simple, complicated, or it can have pus, something that we call empyema. And depending on what type you have, you may need a drain or you may just need antibiotics. Usually the prognosis is very good and you have nothing to worry about. I hope you've learned something new today. Parapneumonic effusions that accumulate in the bag of the lung. Yeah. Please share this video with somebody who might also learn about it. Have a lovely day.